Good afternoon. I'm sorry we're starting a couple of minutes late, but we want to welcome everyone in our live audience and also welcome everyone in our online audience to the Mid-Atlantic Public Health Training Center's February Public Health Practice Grand Rounds on Preventing Violence in Maryland, Data and Gun Policy. And these Grand Round series, which are monthly, are co-sponsored by the Mid-Atlantic Public Health Training Center and the Maryland Department of Health and Mental Hygiene. And this particular Grand Rounds is also co-sponsored by the American College of Preventive Medicine. Before I introduce today's speakers, I have a few announcements for people who are watching online. Please check out our archived Grand Rounds and other online trainings. Excuse me. I'd also like to draw your attention to some of our live face-to-face trainings that are coming up, and we have several in the next couple of months. Cultural Competency for Managers in Baltimore City, February 27th. Grant Writing, March 7th in Montgomery County. Social Marketing, March 18th at Chesapeake College in Y Mills. And then the following day, you can do logic modeling at the same location. And then an Introduction to Cultural Competency on March 27th in Montgomery County. And you can register for all of these trainings online at our website. Our next Grand Rounds on March 20th should be very interesting. It's on distracted driving, something that many of us are too familiar with. For those watching online, please know that you can email a question for either or both of today's presenters by simply clicking on the link. We also ask that you fill in the sign-in form so that we can give our federal funders a better idea of who is watching and how many people are watching today's webcast. With that, I'm going to go ahead and introduce our speakers today, and we're very fortunate to have two excellent presenters. First will be Tom Mannion, who is the coordinator of Maryland's Violent Death Reporting System. He holds a master's degree in forensic psychology and specializes in public health research with a focus in violence prevention. He also has specialized expertise in suicide prevention and previously served as a psychological autopsy investigator for the American Association of Suicidology. Mr. Mannion has spoken about violence, data, and prevention at numerous events and conferences, and recently published an original research paper comparing suicide deaths by victim age. Our second speaker will be John Vernick, JD, MPH, and Mr. Vernick is an associate professor and associate chair in the Department of Health Policy and Management at the Johns Hopkins Bloomberg School of Public Health. He is also co-director of two very important centers at Hopkins, the Center for Gun Policy and Research and the Center for Law and the Public's Health. His work has concentrated on ways in which legal interventions can improve the public's health, and his public health practice includes working with the media, policymakers, advocates, and practitioners to provide information about effective interventions. Professor Vernick received both his BA and MPH from Johns Hopkins University and his law degree from George Washington University. So now I'm going to turn it over to Tom Mannion, who will begin.
All right, good afternoon. Before we get started, I just want to thank everyone who is attending today, those of you here in person and those of you tuning into the webcast. I'm very excited to be here and talk to you a little bit about the Maryland Violent Death Reporting System. As Janie said, I am the coordinator of the MVDRS, and what I'd like to do today is give you a little bit of background about our project, talk to you about the type of data that we collect, what we'd like to do with that data, and then I'm going to conclude with some data highlights. So, in 2002, the folks over at the Centers for Disease Control and Prevention, or CDC, recognized the need for a public health approach to violence and violence prevention. What they wanted to do was collect an extensive amount of data about violence across the nation. So the way that they decided to do that was through a national system which is made up of multiple state-level components. They initially only funded 5 states, one of which was the great state of Maryland, and they have since expanded to the 18 states that you see here. Eventually, what they would like to do is expand this program to all 50 states, the District of Columbia, and the U.S. territories. So let's focus on Maryland's system, the MVDRS, Maryland Violent Death Reporting System. It is housed within the Maryland Department of Health and Mental Hygiene. We first began collecting data in 2003, and we currently have data available through 2010. Now, I realize it's 2013, and 2010 seems like it was a very long time ago, but there's a reason for that, which I will get to a little bit later. The MVDRS mission is broken down into 3 parts. First and foremost is to collect and maintain a detailed body of information on Maryland violent deaths. We then use that detailed body of information to accomplish the second 2 goals, to promote a greater scientific understanding of violence in our state and nationwide, and to encourage the development of effective violent death prevention and intervention strategies. So what constitutes a violent death? What is included in our system? The CDC uses the World Health Organization's definition of violence to define a violent death as that resulting from the intentional use of physical force or power against oneself, another person, or a group. And it should be noted that this definition, the phrase physical force or power, has been expanded in our case to include poisons and drugs. So given this definition, we are looking at deaths that have been ruled homicides, suicides, or deaths of undetermined intent as ruled by a medical examiner. We do assess a small subset of accidental deaths if and only if they involve a firearm. Now, in this respect, Maryland is a bit unique in that we are one of the states that has a centralized medical examiner for the entire state. That means that we can be confident that manner of death rulings are going to be consistently applied for all deaths throughout the state, as opposed to many other states which have a combination of coroners and medical examiners, all of whom have local jurisdiction, and the jurisdictions can overlap one another, and it turns into a big mess. And another way that we're a bit unique is that our medical examiner rules drug overdoses to be deaths of undetermined intent. Many states rule those as accidents. So given the fact that our medical examiner rules drug overdoses as an undetermined death, and the fact that our definition of violence includes poisons and drugs, Maryland is kind of in a unique position to also look at these drug overdose deaths in addition to the homicides and suicides. So even though a drug overdose is not something that one would really consider violent, it is something that we look at alongside the homicide and suicide deaths. So where does our data come from? As I already stated, medical examiner reports from the Office of the Chief Medical Examiner. We also get data from death certificates from Maryland Vital Statistics, and from police reports, which we obtain from state and local law enforcement. So what type of data is included in our system? The short answer for that is all of it. We collect data from multiple different sources, and we're bringing it all together in one place, one centralized place. We're collecting victim and suspect demographics, relationships, education, time, date, location of injury, weapon and wound information, you name it, we collect it. So what really sets us apart is this unprecedented level of detail. We're taking data from multiple different sources and putting it in one centralized location. Another thing that really sets the MVDRS apart is the precipitating circumstances and the in-depth narratives. We are the only violent death surveillance system, or violent surveillance system, that reports on precipitating circumstantial data and records an in-depth narrative for every single death, every single violent death that occurs in Maryland. And that's really the heart of this project. That's really what sets us apart from other data sources. And it goes along with our philosophy on violent death. And that is that every victim of violent death has a story to tell. Whether they died by homicide, suicide, drug overdose, they have a story. There is a specific set of circumstances, a specific set of precipitating events that led to their death. And it's these stories that should be guiding prevention efforts. Because if we know why a person died, then we can, identify certain avenues for prevention. That being said, we also realize that you're not going to affect policy changes and pass legislation and implement programs based on a couple of anecdotes. So we also understand and respect that prevention needs to be grounded in scientific research. So what the MVDRS does to bring these together is we can take these victim stories and through the circumstantial and narrative data, turn those stories into usable scientific data, which we analyze to identify trends and then use those trends to guide prevention efforts. So now that we know the utility of this data, let's look at some of the limitations. We do not, at this point, we are unable to collect data on Maryland residents that are injured out of state. That's merely because it's a data access issue. States that do not participate in this program, they're hesitant to provide us with certain, death certificates, certain data that we would require to include those deaths in our system. So that is why, some of our violent death counts, some of our data might be slightly lower than some other sources that you're looking at. But again, once this program is expanded to all 50 states, this limitation will not be an issue because no matter where a person is from or what state they died in, their death will be recorded in our system and we will have access to it. The second limitation that I wanted to talk about is the data collection timeline. Based on the nature of our data, it is impossible to collect and report the data in real time. You have ongoing investigations, you have pending court dates, people can challenge manner of death rulings for one reason or another. So what we like to do is we usually allow about 1 to 2 years between when a death occurs and when we put it into our system. So, this isn't so much a limitation as it is we're ensuring that we have the most accurate, up-to-date data possible. So now we're going to look at some data highlights from 2010. So just as one caveat for the rest of this presentation, all rates that I report here are crude rates per 100,000 population. So just an overview of the violent deaths in Maryland for that year. There were 1,427 deaths, which is for a rate of 24.7 per 100,000. The male rate was triple the female rate, and the individuals aged 25 to 29 had the highest age-specific violent death rate at 44.5 per 100,000. Now we're just looking at manner of death here. We're looking at manner of death trends from 2003 up through 2010. The black line up here at the top indicates the overall violent death rate for the state in these years, and then these 3 lines down at the bottom break it down by manner of death. The blue line is deaths of undetermined manner, the red line is homicides, and the purple line is suicides. So what we see here is that the data, there's some variability from year to year, but by and large, deaths of undetermined manner tend to have the highest rates, followed by suicide and homicide. One thing we are noticing is that in the last 2 years, 2009 and 2010, there seems to be a rise in the suicide rate. So at this point, we're not prepared to say that suicides are statistically significantly on the rise. We're going to have to wait for some 2011 and 2012 data to come in before we're ready to say that, but it's something we are keeping an eye on. Now we're going to focus on homicide deaths. There were 389 homicide deaths in Maryland in 2010. The most common location of these injuries was a street, a sidewalk, or an alleyway. About 40% of the deaths occurred there. And 2 very striking figures. Nearly half of homicide victims were residents of Baltimore City, and about 80% of homicide victims were Black. Now we're moving on to residential county of homicide victims. You'll see here that there's only 3 counties listed. That is because it's for statistical reasons. We cannot report rates for counties that had fewer than 20 homicide deaths because those rates would be considered unstable. So what we see here, the horizontal black line is the Maryland homicide rate, and the lines at the tops of the bars, it's a 95% confidence interval. So we see here that Baltimore City, and then to a lesser degree Prince George's County, have the highest homicide rates in the state, and they are statistically significantly higher than the Maryland average rate. Now we're going to look at cause of death for Maryland homicides, and we're breaking these down by gender. You see that male homicide victims were overwhelmingly more likely to die by a firearm. 77.6% of male homicide victims were the victim of a shooting. Coming in at a distant second was sharp instrument wounds at 11.8%, followed by blunt instruments at 5.5%. Females, on the other hand, these causes of death were a bit more spread out. Firearms were still the most common, about 35.6% of female homicide victims, followed by the sharp instrument, blunt instrument, strangulation, and some combination of methods. Circumstantial data. The top 4 most common precipitating circumstances for homicides in Maryland, in order, were an argument precipitated by another crime, drug involvement, and intimate partner violence. Now, it should be noted here that intimate partner violence was significantly more common among female homicide victims than it was among males. And what we really see here is that, if you look at particularly the top 3, you see that a lot of Maryland homicides are the result of, certain situations that seem to escalate, an argument that escalated into a physical altercation, a robbery or a burglary that escalated into a murder, a drug deal gone wrong. So there's a lot of these crimes, a lot of these homicides appear to be, in the moment. So regardless of what you see on, CSI or any of the numerous Law and Orders, we don't have, you don't see a lot of those, a lot of premeditated murder because someone wanted insurance money. I mean, that it makes for great TV, but it's not something that we really see a lot of in practice. Now we're going to move on to suicide deaths. There were 481 suicide deaths in Maryland in 2010. The age groups with the highest rates were age 45 to 54, 75 to 84, and 55 to 64. Harford County had the highest suicide rate, 11.4 per 100,000. And another pretty striking statistic, veterans accounted for about 18% of suicide deaths, which we thought was pretty staggering considering they don't make up nearly 18% of the population. And so veterans are actually one of those special populations that moving forward, our project is really going to be paying a lot of attention to. We'd like to release some reports specifically on veterans and veteran suicides to see what separates these deaths from others, so we might be able to look at possible avenues for prevention. Injury location. Overwhelmingly, people died by suicide in a house or apartment. Distant second, motor vehicle, followed by natural area, detention facility, and then a parking lot or public parking garage. But what we see is that people were generally dying in the house. Cause of death for suicide deaths. So what we see here are much more stark differences between males and females. Once again, about half of male suicide victims died by a firearm. It was the most common method of death, followed by hanging at about 32%, and then poisoning or intentional overdose on drugs at about 10%. On the other hand, female suicide victims were equally likely to die by hanging and poisoning, both at 32.3%, followed by firearm at about 20%. Circumstantial data. The most common precipitating circumstances for suicide deaths in Maryland in 2010 were, in order, current mental health diagnosis, disclosed intent of self-harm, intimate partner problem, physical health problem, and then job problem and financial problem rounded out the top 6. Interesting things that we noted, only 55% of victims with a current mental health diagnosis were currently being treated. So that's something, that begs the question, what about the other 45%? Why were they not being treated? Did they, were they not compliant with their treatment? Did they not think they were sick? Did they not think they needed treatment? Were they seeking treatment but couldn't afford it? And then most importantly, had they been in treatment, might their situation have turned out differently? Also notable, female victims were significantly more likely than males to have a history of attempts. 37.8% of female suicide victims had attempted previously, compared to 18.6% of male suicide victims. And then lastly, about 35.7% of victims left a suicide note. A lot of people, there's a preconceived notion that people who die by suicide, the majority of them leave a note, and that's just not true. Only about a third of them do. This is pretty on par with national data as well. So the MVDRS recently published an article in the peer-reviewed journal Suicidology Online. This journal is open access, so it's you don't have to pay for it. You don't need a subscription. You can access it directly online. And it's an excellent resource for suicide prevention data and suicide prevention policy discussions. So we published this article on a comparison of Maryland suicide deaths by victim age. And we did it across a span of 7 years, 2003 through 2009. We broke the deaths down into 4 victim age groups: youth 19 and younger, young adult age 20 to 34, middle age 35 to 64, and then the eldest age group was 65 and older. And what we found were a lot of statistically significant differences between the suicides in these 4 age groups. First of all, the youth suicides tended to be, the majority of them were by hanging, whereas the other 3 age groups, the majority of them were death by firearm, and that trend actually became more pronounced as victim age increased. The youth also, the precipitating circumstances in youth suicides also tended to be a school problem or a non-intimate partner relationship problem. The young adult precipitating circumstances tended to be an intimate partner relationship problem, as well as alcohol and drug abuse. Middle-aged suicide victims also had a lot of issues with alcohol and drug abuse, in addition to financial problems, job problems, not being able to provide for their families. And then the eldest age group was by far the most likely to use a firearm in their death. They were also, those deaths tended to be due to the recent death of a friend or a family member, often a spouse, or due to a physical health issue, such as chronic pain, recent diagnosis of a terminal illness, things of that nature. Okay, so what we really want to pull from this is that the Maryland Violent Death Reporting System is an excellent source for violent death data, particularly if you're looking at detailed information about certain types of deaths, if you're looking for detailed information about precipitating circumstances or any special populations. We also advocate focused or targeted violence prevention efforts. When the population that you're working with is victims of violent death, that group is anything but a homogenous group. It's very diverse, and they've all got their own story to tell, and the MVDRS is able to tell those stories and use those stories to enact prevention. So this is my contact information. Please feel free to contact me if you have any questions moving forward or if you have any data requests. Thank you very much.
Okay, well, thank you for having me. My name is Jan Vernick, and I'm an associate professor here at the Johns Hopkins Bloomberg School of Public Health. And as Janie said, I'm co-director of the Johns Hopkins Center for Gun Policy and Research, and I'll be talking with you about what's been happening in the state of Maryland with regard to firearm policy proposals. And Maryland is much like the U.S. national effort and the effort in many other states. Since the tragic events in Sandy Hook, we've seen an awful lot of different policy proposals. I'm very pleased to say that our Center for Gun Policy and Research here has had the opportunity to weigh in on most of these policy proposals and to try to inform them as best we could by the research evidence. So that's what I also want to talk with you a little bit about today. If I can make this function here, okay. So Tom presented some of the information from Maryland, and before going into Maryland-specific policy proposals, I thought I would start by giving you some of the broad overview of firearm-related deaths in the U.S., and as with Tom, these data are for 2010, and here's the pie chart of the 31,000 gun-related deaths in the United States. And that figure has been sadly quite stable at around 30,000 for a number of years. What might be surprising, and by some contrast with Maryland, is you see the yellow here in the pie chart. The majority of gun-related deaths in the United States are suicides, 19,000 plus suicides. It turns out, actually, that there are more suicides by gunfire in the United States than there are suicides by every other method combined. So suicide by gunfire is an enormous problem in the U.S. We have still 11,000 in red firearm-related homicides in the U.S. every year, so still obviously an important problem. But we ought not to forget about, as public health people, the full scope of the problem. Non-fatal firearm injuries, our best estimate from 2010 is a little over 73,000 injuries that were serious enough to require at least treatment in an emergency department. So that's about a little over 2 non-fatal firearm injuries for every fatality. This is a handgun. So when we're talking about gun-related deaths in the United States, we really ought to be thinking mostly about handgun-related deaths. So this is the pie chart just of firearm homicides by type of gun, and you can see overwhelmingly, and again these are for 2010, but overwhelmingly in red, our gun homicide problem in the United States is a handgun homicide problem. 88% of the firearm homicides where we know the type of gun involved a handgun. Only a small share involved what we call long guns, rifles, shotguns, or other kinds of unusual weapons. Maryland gun deaths, some of this is more specific information than Tom presented. According to the National Center for Health Statistics, 538 deaths by gunfire in 2010. Interestingly, of those in Maryland, the majority are homicides, 300 and change homicides, and 222 or so suicides. The rest are undetermined or accidental deaths. So Maryland precisely flips the national trend or the national data, where the majority are suicides. In Maryland, the majority are homicides, and Maryland's age-adjusted firearm death rate is the 17th lowest, so I guess that's on the good side, but not as good as it could be among the 50 U.S. states. Okay, so that's the background. So let's talk about what's going on in the Maryland legislature. What kinds of policy proposals are being put forth? So you know, of course, that the shooter in Sandy Hook used, in part, what is known as an assault weapon. An assault weapon is generally defined as a civilian version of a military-style weapon. Assault weapons are not machine guns. They're not fully automatic, but they do possess certain military-style features like a flash suppressor, or a place to mount a bayonet, or what's called a barrel shroud, where you can hold your hand on the barrel and it makes it easier to fire the weapon from your hip. Maryland currently bans assault pistols, that is, handguns that have that have these military-style features, but not other kinds of assault weapons, that is, assault rifles and shotguns. So there is a proposal in Maryland that would extend the assault weapons ban to these assault rifles and shotguns. The federal assault weapons ban was allowed to expire in 2004. It was on the books for 10 years, but it had a built-in provision that caused it to sunset, is the term, unless it was renewed, and in fact it did sunset. This is a picture of one of the banned assault weapons under the federal. If you know what this weapon is, I feel sad for you, but this weapon was called a street sweeper. This was banned by name under the federal assault weapons ban, again, since expired. So the 94 federal assault weapons ban, I'm going to try to provide you with some of the information and data so you know how or if these policies are evidence-based. But the 94 federal assault weapons ban, it turns out assault weapons were and are happily rarely used in crime. They're relevant for some of these mass shootings because they can allow you to fire many bullets in a short period of time. But with regard to the overall crime or homicide problem in the U.S., they're a small share of the crime problem. After the ban, they were an even smaller share of the crime problem. The best available research done by Chris Coper and colleagues suggested that the federal ban was associated with maybe a 6 or 7% reduction in homicides, but that reduction was not statistically significant. So you can't say that the federal ban, at least based on that research, reduced homicides. And probably one of the reasons is that federal ban was a very porous law. It was easy to get around it. You could get around it by making, if you were a gun maker, modest cosmetic changes to your gun so that it no longer fit the definition of a banned assault weapon. So the hope is that in Maryland they'll do a better job of defining assault weapons so that it's not as easy for copycat weapons to be sold. So what else is going on in Maryland? The 94 federal law also outlawed what are called large capacity ammunition magazines. The magazine, sometimes called the clip, is the thing that holds the bullets that fits into the handle of a handgun or sometimes a long gun. The federal law also outlawed the future purchase or possession of these large capacity magazines if they were capable of holding more than 10 rounds. That too expired in 2004. Maryland law currently bans magazines that hold more than 20 rounds, so that's a lot of bullets, right? 20 rounds. And so a proposal in the Maryland legislature would reduce that limit to 10 rounds, so it would be the same as the prior federal ban. There isn't an awful lot of data about large capacity magazines. It sort of makes sense that if, especially in the context of a mass shooting, if the shooter had to pause to reload his or her weapon more frequently, that maybe that gives an opportunity for law enforcement or bystanders to interrupt the shooting. And there is anecdotal evidence that in some of these mass shootings, that's precisely what happened. When the mass shooter was forced to stop and reload, that's when folks were able to interrupt the shooting. And unlike assault weapons, where I've mentioned that they're only associated with a modest share of the crimes and homicides in the U.S., large capacity magazines, because they're applicable not just to assault weapons, but to most handguns, to all pistols, essentially, they're at least potentially applicable to many more kinds of shootings. So there's at least the hope that doing something about large capacity magazines has the potential to make a bigger dent in the homicide and crime problem in the U.S., at least than an assault weapons ban did. Probably the governor's signature proposal this year maybe I shouldn't tell the governor what he should call his signature proposal, but from my perspective, the most important thing that he's working on is permit to purchase licensing of gun owners. It surprises people sometimes to realize that actually we don't license gun owners in the United States. It's not like It's not like your car, where if you want to drive a car, we license the driver and we register the car. In most U.S. states, including Maryland currently, we do not license gun owners or people who wish to buy a gun. And the notion of licensing is that before you go to the gun store to buy your gun, you should have to fill out a license application with fingerprints involved and with the opportunity to do a very thorough background check, and there's contact with law enforcement so that people who really ought not to have a gun will probably be less likely to be willing to do that. There is research that my colleague Daniel Webster and I have done that suggests that states that both license gun owners and register the guns do a better job of restricting gun trafficking. That is, there's less within state trafficking and trafficking to other states. A big problem in the United States, of course, is that guns can move easily across state lines, and so states with weaker laws become supply states for states with stronger laws. And again, our research suggests that licensing laws reduce that kind of gun trafficking. So the licensing proposal, I think, would be terribly important. Maryland would become one of, it depends on how one does the count, but maybe 15 or so states that have at least some form of gun licensing. And for my money, that's among the most important things that Maryland could do to try to keep guns out of the hands of high-risk people. The notion of licensing is not to ban guns. It's not to prevent a person who really wants to have a gun from getting one. It's to make it harder for high-risk people to get guns and for guns to be trafficked. This is a picture of, in the middle there, not in the eagle costume, Wayne LaPierre, who is the executive director of the National Rifle Association, standing among the rainbow children, and Eddie Eagle, NRA's mascot. This is how the NRA perceives they ought to try to reduce accidental gun deaths among children. Eddie Eagle teaches children to always be safe around guns using coloring books and other kinds of messages. And it's a very, very popular intervention in schools around the country. Unfortunately, there is no evidence that children exposed to the Eddie Eagle intervention are less likely to play with a gun that they find in the home than children who are not exposed to the Eddie Eagle intervention. Something we know that does work, however, are laws that are called child access prevention laws. These are laws that say if you are going to bring a gun into your home, you have to store it safely. You have to store it in a fashion that young children aren't able to gain easy access to that weapon. In Maryland, the penalty for violation of the child access prevention law is currently a misdemeanor and a $1,000 fine. There is a bill in the legislature that would enhance that penalty to a felony. That is a more serious kind of violation with a 3-year potentially maximum term of imprisonment or a $5,000 fine. There's excellent research evidence that child access prevention laws reduce both accidental, that is unintentional deaths, and teen suicides. As Tom mentioned, where are these suicides occurring, particularly among teens? They're occurring in the home. Teens who ultimately commit suicide with a gun are not going out to the gun store or going to the street to buy a gun to commit suicide. They're using the gun overwhelmingly that they find in their parents' or their relatives' or their neighbors' home. And so there's research, again, that Dr. Webster and I have done that indicates that these kinds of laws can reduce both teen suicides and accidental deaths. But the evidence also suggests that you're more likely to have an effect with cap laws if the penalties are stiffer. And so that's why we're pleased that Maryland is considering stiffening the penalties here. Interestingly, by the way, only 18 of the 50 U.S. states have child access prevention laws, a remarkable thing, really. You would think, who would be against safe storage of guns? But there are 32 states that at least haven't yet gotten around to enacting these laws. Mental health and guns, tremendously important, but also thorny and controversial area. Federal law, which was enacted in 1968, and you see I put the words in quotes because they're old and potentially offensive, understandably to some, but that's what the law says. Federal law prohibits those who have been adjudicated as a mental defective or committed to a mental institution from owning guns. Unfortunately, as we've learned in some of these mass shootings, in particular the Virginia Tech shooting from some years ago, the information about who has been committed to a mental institution or otherwise adjudicated as having mental issues is often missing from the very databases that we check to make sure that a person is legally permitted to have a gun. So that's on the one hand. On the other hand, we know that most persons with mental illness are not more dangerous than the general public. Yet we've also seen that many of the folks involved in some of the tragic mass shootings recently have had very serious mental illness issues. So we need to be able to think about how to balance some of these issues. Maryland law currently says that if you've been in a mental institution for 30 consecutive days for a mental disorder, you're not allowed to have a gun. The governor's bill this year would add additional categories, and you can read them there, of people who wouldn't be allowed to have a gun. But now I'll just give you my opinion. For my money, we haven't really figured this one out. We haven't figured out precisely how best to balance the desire to protect public safety with the desire to minimize stigma for mental illness, which sadly but obviously still exists. And we don't want to discourage people from care seeking by potentially interfering with the doctor-patient relationship. So again, we have things we need to work out there. I think this is the last one I'm going to mention. It seems like a modest one, reporting lost and stolen guns. Maryland, if you have a gun and it gets lost or stolen currently, there is no provision under current Maryland law that says you have to tell anybody, that you have to let anyone know, the police, anyone else, that your gun has been lost or stolen. So the theory behind requiring reporting of lost and stolen weapons is that it potentially enhances accountability for gun owners. If you're required to report that it's been lost or stolen, and instead what you wind up doing is illegally selling it to someone, and then the police come knocking on your door, if you haven't reported it lost or stolen, then again there's the opportunity for the police to hold you accountable more easily for selling it illegally. And I can talk some more about that if you'd like. The Maryland bill would mandate, I think quite reasonably, reporting within 72 hours of your discovery that the gun has been lost or stolen. And again, research that we've done here suggests that something as modest as theft or loss reporting can be associated with less gun trafficking. Again, by attempting to hold gun owners accountable, making it less likely that they think that they can simply transfer the gun to an illegal possessor with no consequences. So I think Maryland has done a very nice job of proposing policies for which there is a strong evidence, or at least theoretical basis. My colleagues and I at the Center for Gun Policy and Research have been very pleased to have been contacted by legislators to provide data, information, testimony. We're doing lots and lots of media interviews, as you might expect. I've talked with you about Maryland, but obviously we're also working at the federal level, and probably the signature issue at the federal level is the notion of universal background checks, that every gun buyer should be subject to a background check, a law that Maryland already, I'm pleased to say, has, but obviously a law that's much stronger if it applies to all 50 states. Thanks very much.
So good afternoon. I'm Dr. Clifford Mitchell, and I am the Director of the Environmental Health Bureau at the Maryland Department of Health and Mental Hygiene. It's a pleasure to be here to moderate this segment of the Grand Rounds. The Maryland Violent Death Reporting System is located within the Environmental Health Bureau. And what we're going to do is we will take questions from online. If you send those questions directly, we will put those up in addition, and you can do those through the website and through the email at maphtc@jhu.edu and you can also, in the audience, we have people here who may have some additional questions. So let me first see if there are any questions in the audience, and we will get to you. We do have a couple of questions already from our listening audience. One question is a basic question, I think, for Tom Mannion about who has access to the reporting system data and how the data feed into prevention efforts, I assume state prevention efforts within the Department of Health and Mental Hygiene and largely in the state. So, Tom?
Yeah. Sure. Oh, okay, this is on. First of all, I'll answer the first question, which is who has access to the data from the MVDRS. At this point, that is just the staff that currently work on it. However, anyone that would like to get data from the MVDRS is welcome to give one of us a call, send me an email, submit a data request. You can go to our website and submit a data request. And we're happy to fulfill any and all data requests, and it's usually a pretty quick turnaround time. We're also looking into the possibility of getting, we have data going back to 2003, so we're looking into the possibility of getting all of that data on the web in a query-based system. We're just looking into that possibility, looking for some possible funding to get that done. So hopefully that'll be in the works pretty soon. And then I'm sorry, what was the second?
And the second question was about how the data feed into prevention efforts at the Department of Health and Mental Hygiene.
Yes. So we are basically using our data with all kinds of groups within the department as well as outside of the department. One group that we were working with is the Governor's Commission on Suicide Prevention. We've been working with them a lot for developing and maybe guiding some suicide prevention efforts. We have several representatives that serve on our advisory committee that are keeping us informed about different programs that are coming up, different programs that they're trying to implement, and we're helping them in any way we can. We also work with the University of Maryland Shock Trauma Center. They have a violence prevention program that we're providing data to them in order to evaluate their violence prevention program, see how effective it is.
Thank you. I think there's a question for Jan Vernick. One question is, when looking at data systems like the violent death reporting system across the country, I think one question that comes to mind is, to what extent looking at that kind of data, and especially when considering, for example, the history of surveillance related to gun-related injuries, are there things that we should be looking at in terms of additional types of surveillance data? Are there holes in the existing surveillance system? And are there types of data that would better inform some of our prevention efforts?
Thanks very much. So probably, as Tom already mentioned, the number one hole is that there's only 18 states part of NVDRS right now, and so it's difficult to do natural experiments or certainly to look nationally without all 50 states. We're hopeful that with President Obama placing greater emphasis on gun-related research through executive order and in other ways that will get expanded to all 50 states. Tom may have a different opinion, but for my money, the thing that NVDRS does better than any other reporting system currently is to have detailed information about the circumstances of the death, the information that's often missing from the FBI's Uniform Crime Reporting System for homicides or the National Center for Health Statistics information for suicides. So if we can learn more about the circumstances, then we can begin to target prevention efforts, again, as Tom implied, through better mental health treatment, or if we're talking about veterans, through addressing things like post-traumatic stress disorder or other issues. So I think the real future gold mine for NVDRS is in the circumstance data.
Tom, did you want to comment on that as well?
Yeah, I completely agree. The National Violent Death Reporting System, the real utility is in those circumstances. We're the only system that collects that kind of data, and it's also the most useful in guiding prevention. So I agree with everything that Jan said, and we're also very hopeful that with President Obama's new focus on gun-related deaths and gun-related violence, that the program will eventually be fully funded nationwide.
Thanks so much. We have a couple more questions from the online audience. With most of gun deaths due to handguns, could you comment on the current emphasis on assault weapons in terms of a ban? And I think that it's not directed at anyone, so I will let either one of you choose to address that.
Sure. So I'm happy to. I think the reason that there's been a focus on assault weapons is not because, as I mentioned in my presentation, not because they are a large share of the gun deaths, but because they tend to be overrepresented in mass shootings, which get, understandably, an awful lot of press attention. It appears that the assault weapons ban at the federal level is not gaining substantial momentum towards passage. We'll have to wait and see. But again, for my money, things like a universal background check, which would apply to all firearms purchased, handguns, assault weapons, everything else, has a greater potential for making a difference in America's homicide and crime problem.
Okay, we have a question in the audience.
Yes, I have a contextual comment. I'm 88, and I took my constitutional law course for a year in Ann Arbor after World War II when I returned from the service. No respectable constitutional lawyer back then would have interpreted Article 2 the way this strange group of majority at the Supreme Court did. The provision was reflective of the French and Indian War experience, in which muskets were very rare, very expensive, and were essential during the use of defending the country against the French and the Indians. And we've had this complete universal reversal of what the founders intended with this current idea that everybody should be armed. And one of the most extraordinary things I find is the success of the NRA in getting some of the municipalities in this country to pass mandates that all adults over 21 must carry concealed weapons in public. And I don't think the American body politic understands what's going on.
May I comment on the Second Amendment issue? So the Supreme Court decision that the Speaker is alluding to was decided in 2008. It's called District of Columbia against Heller, and the District of Columbia had a law since the middle 70s that essentially had banned handguns, and Mr. Heller challenged that as a violation of his Second Amendment, this business about the right to keep and bear arms right. And the Speaker is right. For the first time in history, a federal court struck down a gun law as a violation of the Second Amendment. Justice Scalia, writing for a 5-4 Supreme Court majority, said that yes, the Second Amendment protects an individual's right to own a handgun in the home for self-defense, a right that was violated by Washington, D.C.'s handgun ban. Having said that, since the Heller decision, federal courts have overwhelmingly upheld a vast array of local, state, and federal gun laws other than complete bans of handguns. So at least for now, it appears that the Heller decision stands for the proposition that you can't entirely ban handguns. But there was language in Heller that suggested that many, many other kinds of gun laws, including restrictions on sales, including safe storage that we talked about, including bans on dangerous or unusual weapons other than handguns. All of these other provisions don't appear to be jeopardized, at least for now, by that Supreme Court decision.
It's ironic that Judge Scalia always is talking about the importance of the intenders of the founders, and his decision was a direct conflict with the intention of the people who wrote Article 2.
Thank you very much. Thank you very much for the comment. There's another comment, a question for Tom, a technical question. Could you explain any barriers you've experienced getting access to law enforcement data, and how you addressed these, and what value did law enforcement agencies find through participation in the MVDRS system?
Mm-hmm. Well, I'd say between our three data providers, Vital Statistics, the Medical Examiner, and law enforcement, I'd say law enforcement was the most difficult for us to obtain, merely because there are so many different law enforcement agencies, and they each have their own rules with regard to confidentiality. They each have their own standards and procedures for providing data. So, we have run into some barriers in that regard. I'm happy to say that I've been with this project for about 3 years now, and one of the things that we accomplished after I got here was putting in place some really great MOUs, some really great letters of support from the largest police agencies in Maryland. So they're fully on board, they support what we're doing, and they've been providing us data. This includes the Baltimore City Police, Montgomery County, Anne Arundel County, Baltimore County, et cetera. And I believe we also have several, representatives from each of the police agencies serving on our advisory board as well. And they've all been very helpful. They've all been more than happy to assist us with this project. At the bottom line, the police want to prevent crime. They want to prevent violence, and I think that they see that this project has, a lot of promise, a lot of utility, and a lot of practical applications now. And I think that, that's why they're all very much on board.
Thanks, Tom. Jan, there's a question that I think is primarily directed at you, and it has to do with the role that you consider that television programming, such as police and lawyer shows, play in normalizing guns in our society.
It's a controversial question. There is evidence that young children who are exposed to violence on TV, violent video games, are more likely to act out in a violent way as they age. On the other hand, if you compare the United States with, for example, our peer group of other high-income Western democracies in Europe and elsewhere, we watch the same TV because it's our TV. We export our TV programs to Great Britain and other places. We play the same video games because it's our video games as well. And in fact, if you look at our rates of violent crime, they're actually relatively similar. They're not hugely, we have the same kinds of rates of violent crime as Great Britain. But what's enormously different is our rates of lethal crime. And that's because our crime is much, much more likely to involve a handgun or other kind of firearm. And as a result, our crime is much more likely to become homicide, to wind up being lethal. So yes, we probably should be thinking about issues with regard to exposure to violence, especially for the youngest members of our society. But I think the instrumentality clearly makes an enormous difference as well, and that's what we're here to talk about today.
Okay, thank you very much. Are there any other questions in the audience? And I'm just looking. So if there are no additional questions, then I certainly want to thank all of those of you who have participated online with us. On behalf of Secretary Joshua Sharfstein, Deputy Secretary for Public Health Services Laura Herrera, and and the folks at the Department of Health and Mental Hygiene. We want to thank the Mid-Atlantic Public Health Training Center for this ongoing collaboration, which I believe is now in its 4th year, of presenting grand rounds on a wide variety of topics as a collaboration between a premier School of Public Health and a premier public health agency. I think it represents one of the best examples of the collaboration between public health practice and academic research, and we look forward to seeing you at our future presentations. Thank you very much.
And one more reminder, our next Grand Rounds will be Wednesday, March 20th, 2013, and it will address distracted driving. Thank you.